Okay, so we're going to dive into something that probably none of us enjoy going through, but something we all need to understand.
Yeah.
Pneumonia. And, it's funny how, like, even just getting a grasp of how things work can make us feel a little bit more in control,
Absolutely.
even when it comes to getting sick.
Knowledge is power,
Right.
especially with our health.
For this deep dive, we are starting with a podcast script from Elite Wellness Studio.
Okay.
And they do a good job of laying the groundwork.
Yeah.
But we are going to kind of add those extra layers of understanding and so what insights you can actually use this knowledge for.
I like to think of it as going from knowing something to knowing what to do with it.
Yes, exactly.
Yeah.
So to kick things off, let's just get back to basics for a sec.
Sure.
What is pneumonia really? I mean, beyond just a bad cough.
Pneumonia at its core is an infection.
Go.
But it's not just any infection. It specifically targets those tiny air sacs in your lungs, the alveoli. And these sacs are where oxygen gets into your bloodstream and carbon dioxide gets out.
Right.
And when they get inflamed and filled with fluid or pus because of this infection, it's like trying to breathe through a sponge.
Okay, I'm already getting don't want this vibes.
Yeah.
So the script mentions the usual suspects.
Yes.
Behind this lung mayhem, so we've got bacteria, viruses, and fungi. I'm guessing knowing which one is causing the trouble is pretty important.
It's the most important thing. You have to know what is causing it.
Okay.
Because think of it this way. Treating bacterial pneumonia with an antiviral medication is like trying to fix a flat tire with a sewing kit.
Okay.
The wrong tool for the job.
I love a good analogy.
Yeah.
So if it's bacteria, we're talking antibiotics.
Correct.
If it's a virus, chicken soup and rest rest.
Pretty much.
Okay.
We do have some antiviral medications these days for certain viruses, but a lot of the focus is on supportive care to help your body fight it off. And then we have the rare fungal pneumonia, which usually only affects people with already weakened immune systems.
Right.
And needs a whole different approach.
Okay, so the culprit determines the weapon. Got it. The script also points out that some people are more susceptible to pneumonia than others.
Yes.
And not to scare anyone, but I think understanding why certain groups are at higher risk can help us all make smarter choices, right?
Absolutely.
Like for ourselves and for the people that we care about.
It's about being proactive, not paranoid.
Right.
So, for instance, young children are more vulnerable because their immune systems are still developing.
Makes sense.
Older adults might have weaker immune responses and often have other health conditions that can complicate things.
Right. And those other health conditions like heart issues, lung issues.
Absolutely.
Can make it even more of a threat.
For anyone, regardless of age.
Yeah.
Exactly.
Knowing who's more susceptible helps us take extra precautions, whether it's for ourselves or those we care about.
Yeah.
Okay, let's say, I'm starting to feel a little bit under the weather.
Okay.
What are some of the telltale signs that it might be more than just a cold or the flu? What should send me running to the doctor?
Well, pneumonia often starts with the usual suspects, so cough, fever, chills, fatigue. But here's where it can get tricky. Those symptoms can vary wildly in intensity.
Okay.
One thing that really sets pneumonia apart is a cough that produces phlegm.
Right.
Often greenish or yellowish and sometimes even bloody.
Definitely not the kind of souvenir you want from a trip to the doctor's office.
Right. And if you are experiencing shortness of breath, especially if it comes on suddenly, that's a major red flag.
Okay.
Chest pain, particularly when you breath deeply or cough, that's another sign that something more serious might be going on.
So we've got the cough, the chest pain, the breathing issues. Anything else I should be watching out for?
Yeah.
The script mentioned something about a bluish tint to the lips and nails.
That's a sign of cyanosis. And it's basically your body sending up a giant SOS flare.
Okay.
It means your blood isn't carrying enough oxygen.
Wow.
Often because those tiny air sacs are so clogged, they can't do their job properly.
Yikes. That sounds scary.
Yeah.
I'm guessing that's a call 911 situation, not a wait and see kind of thing.
Absolutely. If you see that bluish tinge, especially coupled with difficulty breathing or confusion, don't wait.
Got it.
Seek immediate medical attention.
Message received. Okay, so let's say we've recognized the warning signs.
Okay.
We've headed to the doctor.
Yep.
How do they actually figure out if it's pneumonia and how bad it is? Is it like detective work for your lungs?
You could say that.
Yeah.
The first step is usually a physical exam where the doctor will listen to your chest with a stethoscope.
Right.
They're not just listening for any old cough. They're specifically trying to hear certain sounds like crackling or wheezing, which can indicate inflammation and fluid in those air sacs.
So it's like those sounds give them clues about what's happening deep inside.
Exactly. Think of it as your lungs sending Morse code signals.
I love it.
But to really see what's going on, they'll usually order a chest x-ray.
Right.
That's the gold standard for diagnosing pneumonia.
What exactly does the X-ray show them? I mean, it's not like they can see the actual bacteria or virus.
Right, they can't see the germs themselves.
Right.
But the x-ray can reveal areas of inflammation or consolidation in the lungs.
What is consolidation?
Consolidation is basically where the air sacs are filled with fluid or pus instead of air.
Right.
And that shows up as white patches on the x-ray.
So more white patches, worse infection.
Generally speaking, yes.
Okay.
The more consolidation they see, the more extensive the infection is likely to be.
Right.
But the x-ray can also help them rule out other conditions that might be causing similar symptoms, like a collapsed lung or heart failure.
Okay, so the X-ray kind of gives them that visual roadmap of what's happening in there.
Exactly.
The script also mentioned blood tests and something called a sputum test.
Yes.
What's the point of those?
Those tests help to paint a more detailed picture of the infection.
Okay.
A blood test can reveal if the infection is bacterial or viral. And it can also show how hard your immune system is fighting.
So a blood test can reveal a lot more than just bacterial or viral infection, right?
Yeah.
What else can it tell us about how my body is fighting pneumonia?
Exactly. It can measure your white blood cell count, for example.
All right.
If your white blood cell count is high,
Yeah.
it means your immune system is sending out troops to battle the infection.
Okay, so it's like getting a peek behind the scenes
Exactly.
at your body's defense system.
Yeah.
And what about that sputum test? What is sputum anyway?
Sputum is just a fancy word for phlegm.
Okay.
That lovely stuff you cough up when you have a chest infection.
Right.
Analyzing it under a microscope can identify the specific type of bacteria or virus that's causing the trouble.
So it's like getting a fingerprint of the culprit,
Yes.
and that helps them choose the right treatment.
Absolutely. It's especially important if they suspect the pneumonia might be caused by a drug-resistant bacteria,
Right.
which can be much harder to treat.
Okay, so we've gathered the clues.
Yeah.
We've identified the culprit.
Right.
Now we need to figure out the game plan for fighting back. And I'm guessing this is where things get really interesting because, as we've learned, the treatment really depends on what's causing it.
You got it. And it's not just about getting rid of the infection. It's also about managing the symptoms and preventing those nasty complications that can sometimes develop.
Right. So let's dive into the treatment arsenal.
Okay.
What are the main weapons that we have in our fight against pneumonia? And how do we choose the right one for the job?
That's a great question, and it's something that we'll unpack in detail in the next part of our deep dive.
All right, cliffhanger. I'm already hooked. So we'll be right back after a quick break to delve into the world of pneumonia treatments and everything you need to know to navigate this tricky illness. All right, we're back, and I'm ready to delve into this pneumonia treatment toolkit. And I'm imagining it's like one of those fancy toolboxes with like a compartment for every scenario.
That's a great way to visualize it. And you're right, there are different tools for different types of pneumonia, and sometimes you need a combination approach.
Right, so let's start with the most common culprit,
Okay.
bacterial pneumonia.
Yeah.
Antibiotics are the go-to weapon here, right?
Yeah.
The script mentions they often work wonders, clearing things up in just a few days.
Yes.
But how do they actually work their magic? I'm kind of curious about that.
Antibiotics are like tiny assassins that target the specific mechanisms bacteria use to survive and multiply.
Okay.
Some antibiotics disrupt the bacteria's ability to build their cell walls, essentially making them burst.
Oh, wow.
Others interfere with their protein synthesis, stopping them from making the essential proteins they need to function.
It's like a microscopic war zone in there.
It is.
And I remember you emphasizing that finishing the entire course of antibiotics is crucial.
Yes.
Even if I start feeling better before I've popped that last pill.
Right.
Why is that so important?
You're right. That's a point I can't stress enough.
Yeah.
It's about making sure that we're completely wiping out the enemy, not just weakening them.
Okay.
Imagine this. You're battling an army of bacteria and you start winning, but then you decide to declare victory prematurely and pull back your troops before you've completely wiped them out.
Oh, I see where you're going with this.
Exactly.
Yeah.
Those remaining bacteria, even if they're just a small weakened force, can regroup and become resistant to the antibiotics that almost defeated them.
Right. So it's like they learn from their near defeat.
Yes.
And evolve.
Yes.
And that's how we end up with those superbugs.
That's exactly right. Those antibiotic-resistant bacteria that are so much harder to treat.
Yeah. Scary stuff.
Yes. And it is a growing concern worldwide. So to prevent that, we need to make sure we're using antibiotics responsibly, which includes taking the full course as prescribed
Right.
and only using them when absolutely necessary.
Okay, so antibiotics,
Yes.
bacterial assassins.
Yes.
What about viral pneumonia? No antibiotics here, right?
Exactly. Remember that analogy about trying to fix a flat tire with a sewing kit?
Yeah,
That's what it would be like to use antibiotics against a virus.
right.
They just don't work that way.
Oh.
Viruses are sneaky little things that hijack your own cells to replicate.
So instead of attacking the virus directly, what's the strategy for treating viral pneumonia?
For most cases of viral pneumonia, it's about supporting your body's own natural defenses.
Okay.
Rest is crucial to give your immune system the energy it needs to fight. Staying hydrated helps thin the mucus, making it easier to cough up.
Right.
And over-the-counter medications can help manage those pesky symptoms like fever and aches.
So it's all about letting your body do its thing while making it as comfortable as possible.
Exactly. Think of it as creating the ideal environment for your immune system to thrive and kick the virus's butt.
Love that. The script also mentions antiviral medications.
Yes.
But I'm guessing those are reserved for special cases.
Yes, antivirals can be used for certain viral pneumonias, but they're typically reserved for severe cases or for people who are at higher risk of complications like those with weakened immune systems.
Okay, so we've covered the bacterial and the viral battle plans.
Right.
What about the rare fungal pneumonia?
Yeah.
What's the strategy there?
Fungal pneumonia is a different beast altogether, and it often requires long-term treatment with antifungal medications.
Okay.
These medications work by targeting the unique features of fungi, but the treatment can be quite lengthy, often lasting for several weeks or even months.
Sounds like fungal pneumonia is a tough one to tackle.
It can be, which is why early diagnosis and treatment are so important.
Okay, so far we've been talking about, managing pneumonia at home.
Yes.
But the script also mentioned that sometimes hospitalization is necessary.
Right.
When does pneumonia kind of cross that line from, I can handle this at home, to, I need some serious medical intervention?
That's a critical question, and it's something you should always discuss with your doctor.
Okay.
But generally speaking, hospitalization might be necessary if you're having trouble breathing, if your oxygen levels are very low, or if you have other health conditions that make you more vulnerable to complications.
Let's say I'm in that situation. I'm admitted to the hospital.
Yeah.
What kind of treatment would I expect? Is it just like a more intense version of at-home care?
Well,
Or are there other weapons in their arsenal?
in a hospital setting, they have a wider range of tools and expertise to manage severe pneumonia.
Right.
They can provide oxygen therapy through a mask or a nasal cannula to boost your oxygen levels and ease breathing difficulties.
Okay.
They can also give you intravenous fluids to prevent dehydration, which is crucial for recovery.
So it's like a supercharged support system
Exactly.
for your body while it's fighting. And in some cases, they might need to use a ventilator, which is a machine that helps you breathe if your lungs are too compromised to do it on their own.
Yeah.
Okay, not gonna lie, that sounds a little scary.
I understand, but it's important to remember that ventilators can be life-saving in severe cases of pneumonia.
Okay.
They give your lungs a chance to rest and heal, while the machine does the heavy lifting of breathing for you.
Knowing they have that kind of backup if needed is definitely comforting.
Yeah.
But even with all of these treatments, I'm guessing there's still a chance that things could go south, right?
Unfortunately, yes.
The script mentioned potential complications.
Right.
What are we talking about here? How common are they?
While most people recover fully from pneumonia with no lasting effects, there are some potential complications that can develop, especially if the infection is severe or not treated promptly.
Okay, so let's have, what are the things that could potentially go wrong?
One of the most serious complications is sepsis, which is essentially your body's immune system going into overdrive and attacking its own tissues and organs.
Okay.
It's a life-threatening condition that can lead to organ failure and even death if it's not treated quickly.
Wow, that sounds terrifying.
Yeah.
What are some of the signs that pneumonia might be progressing to sepsis?
Sepsis can be tricky to recognize because the symptoms can vary,
Okay.
but some common red flags include high fever, rapid breathing, confusion, and low blood pressure.
Okay, those are definitely things to watch out for.
Yes.
What are some other complications that can arise from pneumonia?
Another potential issue is pleural effusion,
Okay.
which is a buildup of fluid in the space between the lungs and the chest wall.
Okay.
This fluid can compress the lungs, making it difficult to breathe.
So it's like your lungs are being squeezed from the outside.
Exactly. It's a bit like having a water balloon slowly inflating around your lungs, making it harder and harder to expand them.
Yikes. That paints a vivid picture.
It does.
Okay. What else?
Another complication is something called a lung abscess, which is basically a pocket of pus that forms within the lung tissue.
Yeah.
It's a serious issue that often requires long-term antibiotic treatment and sometimes even surgery to drain the abscess.
That definitely sounds unpleasant.
It can be.
Anything else we need to be aware of?
Yes, there's acute respiratory distress syndrome, or ARDS.
Yep.
This is a severe lung injury that occurs when fluid leaks into the air sacs, making it very difficult to breathe.
Okay.
It's essentially a more extreme version of what happens in pneumonia.
So it's like pneumonia on steroids.
You could say that.
Yeah.
It's a serious condition that often requires intensive care, including ventilation and other life support measures.
Okay. I think I'm starting to get a sense of the seriousness of pneumonia now.
Yes.
It's not something to take lightly.
It is not.
Early detection
Yes.
and treatment are key.
Absolutely.
But I'm also thinking back to what you said earlier about prevention being the best medicine.
Yes.
And I know we touched on that briefly before, but let's dive a little deeper into that arsenal of preventative measures.
Sure.
What are the best ways to avoid ending up in this pneumonia battle in the first place?
That's a great segue. Let's shift our focus from treatment to prevention
Yeah.
and empower ourselves with the knowledge and tools to stay healthy and resilient.
I'm all for that. So what are the best strategies for keeping those pneumonia-causing villains at bay?
Well, there is a whole range of strategies, from simple everyday habits to medical interventions like vaccines.
Okay.
We'll unpack all of those in detail in the next part of our deep dive.
All right, another cliffhanger.
Yeah,
I'm eager to learn all the secrets to pneumonia prevention.
absolutely.
So we'll be back after a quick break to equip ourselves with the knowledge and tools to stay healthy and pneumonia-free.
All right, we're back, and I'm ready to arm myself with all the pneumonia prevention knowledge we can pack into this deep dive.
Yeah.
You know, we've covered the villains and the battle plans, but now it's time to focus on building those immunity fortresses. I love that analogy, and you're right, prevention is all about building resilience,
Right.
strengthening our defenses, and making ourselves less inviting targets for those pesky pneumonia-causing germs.
So let's start constructing those defenses.
Okay.
Where do we even begin?
Well, one of the most powerful tools we have in our prevention arsenal is vaccination.
Okay.
Vaccines are like giving your immune system a personalized training course, teaching it to recognize and fight off specific pathogens before they even have a chance to cause trouble.
Okay, that makes sense. But I have to admit, I've always been a little fuzzy on how vaccines actually work.
Yeah.
It seems almost like magic. You get a shot and suddenly you're immune to a disease.
Right.
Can you demystify that process a bit?
Absolutely. It's not magic, but it is pretty amazing science.
Yeah.
Vaccines work by introducing a weakened or inactive version of a pathogen, like a bacteria or a virus, into your body.
Okay.
This sneak peek doesn't actually cause you to get sick, but it gives your immune system a chance to study the enemy and develop antibodies. Those specialized proteins that can neutralize the real deal if you ever encounter it.
So it's like showing your immune system a wanted poster of the bad guy.
Exactly.
So it knows who to arrest if they ever show up at the party.
That's a great way to put it.
I love a good analogy.
And the beauty of it is that once your immune system has learned to recognize a specific pathogen, it remembers it for years, sometimes even a lifetime, making you much less likely to get sick if you're exposed to the real thing.
That is pretty cool. So when it comes to pneumonia, which vaccines are the MVPs?
The pneumonia vaccine itself is a great place to start,
Okay.
especially for older adults and anyone with underlying health conditions that make them more vulnerable to pneumonia.
Okay.
There's also the flu vaccine, which is important for everyone because the flu can weaken your immune system and make you more susceptible to pneumonia.
I always thought the flu shot was just about preventing the flu,
Uh-huh.
but I never realized it could also help protect against pneumonia.
That's right. It's all about reducing your overall risk of respiratory infections.
Okay.
And don't forget about other vaccines that can indirectly protect against pneumonia, like the whooping cough vaccine
Right.
and the measles, mumps, and rubella vaccine.
Okay, so vaccines. Big deal.
Yes.
What about those everyday habits that we can incorporate to boost our defenses?
Yeah.
The script mentioned good hygiene,
Uh-huh.
but I'm guessing that goes beyond just a quick hand wash before dinner, right?
You're right. Good hygiene is about creating a germ-free bubble around yourself as much as possible.
Okay.
Think about all the things you touch throughout the day. Doorknobs, elevator buttons, shopping carts.
Right.
And then think about all the times you touch your face, your eyes, your mouth.
Okay, I'm already feeling a bit germophobic.
It's not about being paranoid,
Yeah.
but just being mindful.
Right.
Washing your hands frequently with soap and water, especially before eating and after using the restroom, is your first line of defense.
Okay.
If soap and water aren't available, hand sanitizer with at least 60% alcohol is a good backup.
Okay, hand hygiene. Check. What else can we do to keep those germs at bay?
Avoiding close contact with people who are sick is another important strategy. I know it's not always possible, especially if you have young children or work in a public-facing job, but try to minimize your exposure as much as possible.
That makes sense, and I'm guessing those good old-fashioned manners like coughing or sneezing into your elbow instead of your hands can go a long way in preventing the spread of germs.
Absolutely. Those little things can have a big impact. And don't forget about keeping your own home and workspace clean and disinfected, especially surfaces that are touched frequently.
Okay, hygiene. Check. What's next on our prevention checklist?
Let's talk about something that's a bit more of a lifestyle choice. Smoking.
Okay.
We know that smoking is harmful for a whole host of reasons,
Right.
but when it comes to pneumonia, it's particularly damaging to those precious air sacs in your lungs.
I remember you describing those air sacs as being like tiny balloons that get inflamed and filled with fluid. When you have pneumonia,
Yes.
what does smoking do to them?
Smoking is like sandpaper to your air sacs,
Oh, wow.
making them less efficient at absorbing oxygen. Imagine trying to breathe through a straw with tiny holes in it.
Yikes.
And the damage doesn't stop there. Smoking also weakens your immune system, making you more susceptible to infections in general, including pneumonia.
Okay, that's a pretty convincing argument for quitting, or better yet, never starting.
Absolutely. Quitting smoking is one of the best things you can do for your overall health, and it's especially important if you're trying to prevent pneumonia.
Okay, smoking.
Yeah.
A big no-no.
Yes.
What else can we do to build up those immunity fortresses?
This is where those healthy lifestyle habits we often hear about come into play.
Okay.
Eating a balanced diet, getting regular exercise, and prioritizing sleep are all crucial for maintaining a strong immune system.
I know those are all good in theory, but sometimes it feels like generic advice.
Yeah.
Can you give us some more specific, actionable tips
Sure.
for incorporating those healthy habits into our busy lives? What does a balanced diet actually look like for boosting immunity?
You're right. It's all about making those healthy habits practical and achievable.
Right.
When it comes to diet, think about eating the rainbow, a variety of colorful fruits and vegetables that are packed with vitamins, minerals, and antioxidants. Those nutrients are like fuel for your immune cells, helping them function optimally and fight off infections.
So instead of reaching for that bag of chips, I should be grabbing a handful of berries
Sacs.
or some carrot sticks.
Yes. And don't underestimate the power of protein.
Oh,
Lean protein sources like chicken, fish, beans, and lentils provide the building blocks for those immune cells.
okay, so fruits, veggies, and protein. Got it.
Yes.
What about exercise?
Yes.
How much and what kind do we need to boost our immunity?
Aim for at least 30 minutes of moderate intensity exercise most days of the week.
Okay.
Moderate intensity means you're breathing a little harder than usual, but can still hold a conversation.
So we're not talking about training for a marathon here.
No, just getting your heart rate up and moving your body, brisk walking, dancing, swimming, gardening, whatever activities you enjoy that get you moving.
Okay, so moving our bodies regularly is a must.
Yes.
What about sleep? I know I always feel more vulnerable to getting sick when I'm sleep deprived, but what's the science behind that?
Sleep is like your body's nightly maintenance crew, repairing and rejuvenating everything from your muscles to your immune system.
Okay.
When you don't get enough sleep, that crew can't do its job properly, leaving you more susceptible to infections.
So it's like skimping on sleep is like letting the guards at our immunity fortress fall asleep on the job.
Exactly. Aim for 7 to 8 hours of quality sleep each night.
Wow.
Make your bedroom a sleep sanctuary, cool, dark, and quiet, and establish a relaxing bedtime routine to wind down before you hit the hay.
Okay, sleep hygiene. Check.
Yes.
So to recap, we've got vaccines, hygiene, ditching the cigarettes, eating our fruits and veggies, moving our bodies, and prioritizing sleep.
Yes.
That sounds like a pretty solid blueprint for pneumonia prevention.
I agree. It's not about being perfect all the time, but about making those healthy choices consistently to build resilience and protect yourself from those pesky pneumonia-causing germs.
Okay, we've covered a lot of ground today. what causes pneumonia, how to recognize the signs, the different treatment approaches, and those all-important prevention strategies.
Oh, yeah.
I feel like I've leveled up my pneumonia knowledge for sure.
I think so, too.
So before we wrap up this deep dive, what's one key takeaway you want our listeners to walk away with? What's the one thing they can do today to take control of their pneumonia risk?
I would say it's this. Don't underestimate the power of prevention.
Okay.
By taking those simple steps we've discussed today, getting vaccinated, practicing good hygiene, making healthy lifestyle choices, you can significantly reduce your risk of getting pneumonia.
Yeah.
And if you do happen to get sick, knowing the signs and seeking prompt medical attention can make all the difference in your recovery.
Well said. I think we've given our listeners a pretty comprehensive toolkit to navigate the world of pneumonia. So stay healthy, stay curious, and keep learning.
Absolutely.
And we'll catch you next time for another fascinating exploration into something important.
Yes.
Until then,